Good evening. I'm Kelly Wright. Thanks for joining me as we spend the next hour together. And I am hoping that you're safe and well, taking care of yourself and your family because you matter. My opening observation tonight, the least of these: Black America, Brown America, Native Americans, doing essential jobs that helps and benefits the most of us. And yet, COVID-19 is hurting the least of us. You see, in so many communities of color, we've seen health disparities and financial inequities cause us to have more of a death toll from this COVID-19 pandemic, which has claimed now more than 200,000 lives. All colors, all political stripes, all religious and ethnic persuasions. Yet it's the least of these who are impacted the most, by and large, because of the essential jobs that they do, which we all depend on, and the places where they live, their zip codes. It's important, my friends, that we start showing concern for the least of these. Because if we fail to do that, and we keep flip-flopping with information from the CDC, and keep politicizing wearing a mask or not wearing a mask, we will only continue to hurt the least of these, which ultimately will affect the most of us. And those are my opening observations. Joining me now to talk more about the CDC and the guidance it's putting out, or the lack thereof, is Dr. Yolanda Hancock. And she's a pediatrician as well as a public health expert. She works with the George Washington University's Milken Institute of Public Health as well. Doctor, good of you to join us today. And the CDC is sending out a mixed message. And just yesterday, you and I discussed not only the CDC, but the president and the federal government putting out these mixed messages, and we're dealing with 200,000 deaths from the coronavirus. What's going on?
Madness and mayhem.
Wow.
When you politicize a public health issue, what you're going to see is mixed messaging. And, I can't say that I don't fault the CDC. The CDC is muzzled by the federal administration. And this isn't the first time that the CDC has been filtered as a result of what the president wants to put out, not even in terms of limiting this to Trump's administration. We saw something similar back when big tobacco was influencing reports being pushed out of the CDC. So I want people to understand that this isn't a new phenomenon, unfortunately, but it is a very scary one.
Scary one, particularly given the fact that this coronavirus is showing no signs of letting up, and we have not bent any curve or flattened the virus. It's still here, and it knows no bounds, because we have, in my opinion, we have not done enough to really educate people on just simple things like wearing a mask and social distancing. But now, Dr. Hancock, as you know, the CDC took down its messaging just a day ago that talked about this was an aerosol, that it could spread through the air. You have been telling us this on this program since March, that it's aerosol, that it can, these droplets are tiny and they can go anywhere through your singing, through your speaking. Why would the CDC take that off?
Again, it goes back to this being a politicized issue as instead of a public health issue. And we've seen this with the CDC throughout this pandemic. It first started with the wearing of masks and advising people not to wear masks. They specifically said, do not wear masks. Then just a month ago, they put out an advisory that asymptomatic individuals are not at risk for transmitting COVID-19, when we know that 80% of COVID-19 cases have come from asymptomatic individuals, where 40% of those with COVID-19 are asymptomatic. And now they're taking away information that we already knew. There was a study that we talked about on your show that came out in March demonstrating the aerosolization of COVID-19. We know that respiratory droplets themselves travel anywhere between 3 feet and 22 feet, with the average being 6 feet, which is why we practice 6 feet of social distancing. But what we also know is that when research has demonstrated that COVID-19 lands in an exam room on spaces where patients were not in contact, that lets us know that this is aerosolized. Even the president himself, in a recording, said that this virus is aerosolized. So this isn't new. And for the CDC to take this off the website is just irresponsible. But again, I question who was the voice behind the need for them to take that off the website.
So once again, whoever is pulling the strings on the CDC is becoming a place of questioning. People are questioning the CDC, which is supposed to be the end all and be all for our health experts to give us the information, the science that we need. Dr. Anthony Fauci has been stating all along that this virus is still among us. He's fearful that it may get more intense and spread further during the cold season. The cold season is almost here in the East as we are now entering in autumn.
Right.
What are your concerns from a public health perspective?
My biggest concern is the destruction of the trust of the American people when it comes to our institutions, our public health institutions. The federal administration attacked the WHO and actually withdrew funding from our global public health organization. And now the CDC is being undermined because of politics. We were already in a place where people did not trust some of the information coming out of the CDC even before the pandemic that was established here in the US. When we see things like this happen, how is the American public supposed to trust the CDC, especially as we move towards accepting a vaccine? How will we know that we can trust the data coming out in terms of the numbers of COVID-19 cases, the number of COVID-19 deaths, and the safety as it relates to the vaccine at a point in time where we're supposed to be building trust so that people may be comfortable in getting the vaccine? We're absolutely destroying it as a country, and it's a shame.
It is a shame. I'd like you to stay with me for one more segment because when we come back, I'd like to talk once again about COVID-19's impact on essential workers, which of course is comprised predominantly of African Americans and Hispanic, Latino Americans, and also the impact that it's having on Native Americans. Back with more of Dr. Yolanda Hancock on this very critical issue of COVID-19. It has not left us. We've got to be prepared. And we're back with the program. I'm talking to Dr. Yolanda Hancock. She's a public health expert, also a pediatrician, and she works with the Milken Institute on Public Health at George Washington University. Coming up later on the program, we're going to be talking to Reverend Anthony Evans, who's the president of the National Black Church Initiative. And he'll be talking about COVID-19's impact on the Baltimore area, the inner city area, the urban area. These are areas that you're familiar with, and you're also familiar with DC. How problematic is it in Baltimore?
What we're seeing is similar numbers to what we see here in the county in which I reside, in Prince George's County. Our county, Prince George's County, actually leads the state of Maryland in terms of COVID-19 cases, and Baltimore isn't too far behind. Baltimore is a microcosm of what we're seeing across the country, where Black and Brown communities are being disproportionately impacted by COVID-19 for a variety of reasons. One, because of employment. Two, because of the health disparities as it relates to chronic diseases that facilitate increased severity and death from COVID-19.
And it's also, is it also because of the fact that there are multi-generational families and they're living closely knitted together in communities, and you have no way of actually getting away from people? Is that another factor?
Absolutely. It's a combination of that with those multi-generational families and family members within those households that have to report for work. It's also methods of transportation where disproportionately Black and Brown communities are in need of the use of public transportation, where safety measures may not necessarily be in place in situations where bus drivers have been attacked because they've compelled people to wear masks, and metro systems have actually backtracked the requirement for mask wearing so as to protect the transportation workers. We again put our communities at risk. So it's a variety of reasons, but to your point, in these multi-generational homes, especially when no provisions have been made for isolation, when one of the residents ends up coming down with COVID-19, it puts the entire family at risk, from the seniors down to the babies.
I look at all of this, and I don't always state it because I don't want to cause any fear, but this is heartbreaking to watch. When you realize that essential workers, this is why it's really happening in our communities. We're essential workers. We've got to go to work. We can't always work from our homes.
Absolutely.
And then you factor in the fact that there's no place to go, like you mentioned, to isolate yourself or quarantine yourself. I remember talking to someone in Staten Island on this show who actually quarantined herself in her car so she wouldn't infect her children. I mean, doctor, I don't understand why we're not hearing this from the federal government, from the White House, and from the CDC. And we keep hearing about Operation Warp Speed. Break this down for me as a mother and as an African-American woman and as a trained physician, a doctor, how this impacts you and when you look at the landscape of America, realizing we could have prevented 200,000 deaths.
Yeah.
How does this impact you personally?
I mean, it's incredibly heartbreaking and frustrating. A close friend of mine, within a week, lost 2 of her family members to COVID. Just 2 weeks ago. And it just makes no sense. It makes absolutely no sense. I don't believe in fear. God has not given me a spirit of fear, but of sound mind and understanding. But at the same time, he's also given men free will. And I think what we see with this pandemic, it's symptomatic of a larger issue focused on priorities, where we're putting politics and profits over people, where people are dealing with unemployment and underemployment and lack of insurance that's further facilitating COVID-19 cases. And we're going to continue to see it as the winter rolls around, and flu and COVID and allergies and colds all come together in one diabolical combination, and things start getting shut down because numbers are increasing. We're going to end up going backwards if we do not do something right now. Every single day, every single hour, every single minute, every single second is an opportunity to make a better choice to protect the lives of us as a country.
Doc, I hope we're listening to the things that you're saying, and my condolences to your friend and to you for the loss. And we're seeing that everywhere. But I just appreciate your insights and your knowledge and your science and your faith, by the way. It seems to me that if people were really exercising their faith, they would use a sound mind and let that rule over their free will to decide to do the right thing. Wear a mask. Just wear a mask and socially distance yourself. I just remember going to the Supreme Court, and most of the people that were out there to remember RBG, Ruth Bader Ginsburg, they were wearing masks.
Yeah.
It's just that simple. Dr. Yolanda Hancock, appreciate you all the time. Thanks for being on the program. We're coming back. We're going to talk more about that situation in Baltimore with the NBCI, the National Black Church Initiative. That's coming up next. And welcome back. We're talking about a very important and critical aspect of COVID-19, and that is getting the knowledge out onto the streets of African-American communities, particularly in hard-pressed areas, inner cities like Baltimore, Maryland. My guest is Reverend Anthony Evans. He's head of the National Black Church Initiative. And you had a recent visit to Baltimore, and you were telling me that 75% of the men that you encountered in the inner city of Baltimore, one of the hardest areas and toughest areas in that city, most of the men were not wearing masks, and those that did wore it under their noses or their masks were dirty. Is that a problem because of lack of information getting to the streets and into the hood, as we like to say, to let all of our brothers and sisters know, hey, there's a problem out here, mask up?
Well, it is a problem because remember that Governor Hogan has touted as Maryland as one of the places where COVID-19 statistically they're small, but in the Black community, still our death rates is outrageous. And so I'm not sure why he is touting so successful a COVID-19 response when the poorest of your poor citizens are getting the brunt of this disease still. And second, we have a Black lieutenant governor, Black lieutenant Republican governor there, and we have not even heard from him. One of our response in our critical response team, that's what we call it, our critical response team, we send out 8 of those, and we distribute over 1,500 masks, but it's still not enough. We didn't even touch the front. So what we did in response, Kelly, is the fact that, is that we are talking to Costco's, and we are trying to order anywhere between 500,000 to 1 million masks. And my fundraising team are now trying to figure out exactly how we are going to fundraise for that. So this is a response. And when we give away the masks, we will also give away hand sanitizers as well. And most important, we are putting together a 1-sheet information on COVID-19. I called the Baltimore Health Department and they didn't have any literature. So you can't make this up anymore.
And the state of Maryland with Governor Hogan and the Lieutenant Governor, and reaching out to them, what has their response been thus far in getting this information out to Black urban areas? I know not far from Baltimore is Prince George's County, where I spoke to Dr. Yolanda Hancock about the issue in Baltimore, and she basically states it's like Prince George's County, where there is a problem, a very dire problem that needs to be addressed.
Yeah, Prince George's County is miles apart from Baltimore in terms of COVID-19. Angela Alterbrooks is doing such a fantastic job down there. She has a strong team and a lot of social distancing. You can't go to a supermarket in Prince George's County, but seeing 80% or 90% people who have masks on correctly. And that's another thing that why we are producing that 1-page sheet. We want to teach brothers and sisters how to put that mask on correctly to protect not only themselves, but their loved ones, their families, and everybody else. I want to send a message out to Black men. Get out of the face of other Black men. You are spreading COVID-19. You need to social distance, my brother, and you need to have your mask on. Whatever you're saying is not that important, that you have to be up into the face of other men. And same as my sisters as well, but seems that a lot of the sisters, as much as they're educated, they're doing a fantastic job of keeping their masks on. The uneducated sisters are following the brothers, which don't know what they don't know what they're doing, and that's why we sent out 8 teams of physicians, public health specialists, ministers, and volunteers through our critical response team that we're doing. So we're just, what we are trying to do is we're trying to raise funds, and it's been very, very difficult. We finally got through the CDC. I hope something is finally going to come from them, but it has been since March, Kelly, and this has been just devastating for the African-American community. And not only are we in Baltimore, but we're in Houston, we're in LA, we're in Atlanta, we're in New Orleans, and we're getting the same type of response in terms of PPEs, in terms of coordinating with the public health structure down there. Everybody seemed to be going crazy, and there seemed to be such confusion at such local levels. This is unbelievable as a devastating disease.
Reverend Anthony Evans, I know there's a lot more work to be done. Keep us in touch in terms of what's going on with the National Black Church Initiative and other churches that will come into play in trying to help so many people in need. Appreciate you being on the program today. Thank you.
We thank you. Thank you so very much for getting this word out for us.
And we're coming back with more after this. In fact, we're going to talk about what you can do to try to improve your personal economy. Is that possible in this tough economic time because of COVID-19? We'll talk to one lady who says there is a way. That's next. Welcome back to the program. So we've seen and heard what's going on in terms of COVID-19 and its impact, its disproportionate impact on Black Americans, Brown Americans, and Native Americans. But I'd like to introduce to you someone who's actually engaged with the White House Coronavirus Task Force. She's out there on the front lines with her organization, her company called MCI Diagnostic Center. They've been doing a lot of testing. She's been on the program before. Let me introduce you, Colleen J. Payne Neighbors. Colleen, thank you for joining us today.
Absolutely. It's always my pleasure, Kelly, and I appreciate you having the opportunity to have me back on the show.
You know, I appreciate you too, and the great work that you've been doing on the front lines of the COVID-19 pandemic, because your company, based in Tulsa and also operating out of other cities, for example, you're in Dallas, Texas today, you've been out there conducting a lot of testing, not just for the White House Coronavirus Task Force, but for people who need it, Oklahoma particularly. Tell me about that and how you got involved in that.
So, MCI is a national reference laboratory. We are based in Tulsa, Oklahoma. We're also in Dallas. And we have been on the front lines of the corona testing since about December, because we have one of the larger contracts in the country with the Department of Labor. We were tasked with the opportunity to provide care for them just in case that this got really, really where we are now. And we were tasked with that in December. So it allowed us to be on the front line of this. And right around March, we were one of the first laboratories in the country to receive the equipment to test. And from an African-American's perspective, we're probably the only African-American laboratory certified and qualified with the equipment that we have, and as a part of the task force as well. So we got involved early on.
Yeah, you were out there before it even became a pandemic sweeping across the world. And the fact that you're an African-American owned company speaks volumes about the legacy that you're establishing for not only your loved ones, but for people who have followed you and followed your career. Tell me about your career, how all of this began for you.
So I, by profession, am a nuclear medicine technologist, and about 24 years ago, I was working at a hospital or a clinic, and I kept watching all of these patients in rural Oklahoma. I did a test called a myocardial perfusion scan, which is basically, it's the test that determines whether or not you have angioplasty, whether or not you have a stent, whether or not you have a bypass. And what I would do is I would do this test, but it took a whole village for people to take off work, to bring mom and dad and all of the people that would come to basically, I would sit and watch how many people were going to wait for me to kill their mom or dad. And we would have like sometimes 10 family members that came about 20 years ago for this test. And I just had a great idea. What if, instead of having all these people come from rural areas, what if I could provide this service to rural America, rural Oklahoma? So I came up with a very unique concept that I had a truck built out of Chicago, and I drove that truck around. It was like a semi. It hadn't been done before, and drove it to all rural America and provided testing. And then shortly after that, the doctors would ask me if I could do more testing. And so we continued to increase our testing capacity, and it allowed me to grow more. And so we became the largest African-American owned diagnostic center in the country. We did nuclear medicine. I have a nuclear regulatory license, MRI, CT, nuclear medicine, fluoroscopy, pain management. So we did a whole gamut of testing. And about 7 years ago or 6 years ago, not that I can say that I do anything better than anyone, I just can do it. And I can do medicine, and that is who I am. So it was kind of when the pain management craze started, we just couldn't get enough of our testing back. And so because of that, I decided that it was time for us to add another extension to us, and I added laboratory services to us, I think in about 2013, 14, somewhere in there. And so we've grown consistently. And within the last several years, or about 4 years ago in 2017, we started down the government path, which we were always a part of that because I did a lot of contracting with the government and Indian Health Services.
We're coming back with more after the break. Colleen, I hope you can see the smile on my face because I am certainly one who admires your great work and your faith and your intestinal fortitude. You did all of this, by the way, as a single woman, a single parent, and you built this company. And I just find it truly amazing and inspirational, even in the midst of the COVID-19 pandemic we're faced with. I started this program off talking about in my opening observations about the least of these. And you were among the least of these. I mean, no one would have looked at you and said, she can't make it. And look at you today. And still not forgetting where you've come from and helping the least of these. I admire that ability that you've had and that tenacity to keep saying, I'm going to keep doing it no matter what.
Starting this company about 24 years ago, failure was never an option. And I still use it as today. Failure was never an option. So all that I ever knew was to keep going and to keep moving forward. So therefore, that's all that I had. We moved forward. Failure was never an option. Part of my book that I wrote, it's just never been, I never quit. And that's the most important thing with entrepreneurs is you never give up, you never quit.
Is there a need for your testing organization to work with other companies or churches within the Black community to make sure that more people in the inner cities and the rural areas can have more testing?
Absolutely. Because one of the things that we found being on the ground, we deploy from Oklahoma often, and we have been in Houston and Dallas and Atlanta and North Carolina, South Carolina, Maryland, Georgia. So we've been all over the country. And one of the biggest things that we find is that so much money is being thrown toward coronavirus testing. And we constantly are hearing that we're not being tested. As from an African-American perspective, we're not getting tested. We're still affected. We're dying at an alarming rate. We have more underlying conditions, but yet we're not being reached. And so one of the things that MCI did as a whole, and we took on a financial huge obligation, is that we supported months on end going out to a lot of the largest African-American communities. We went to a lot of the churches. We deployed at a lot of the community centers. We did it because we were not being tested. And so there is still a huge need, because you look at some of the bigger companies, the Quests and the LabCorps of the world, those guys aren't touching us. And when they do, we as an African-American population sometimes don't believe that the services that we sometimes will get are for our benefit. And so the only difference is that as a company, MCI, I can come out and say, we mean no harm. We're here to help. We're here to make you live. We're here to make you survive.
I need to ask you, how can people line up to support you and you support them within the Black community? I just had Reverend Anthony Evans of the National Black Church Initiative. He represents some 34,000 churches. And it sounds to me like as well as he does, as well as Dr. Yolanda Hancock and so many others who are concerned about the African-American community and the impact that COVID is having on them. We've got to create an army within our own communities, notwithstanding the fact that the greater community still needs work as well. But how can we reach out to align ourselves with you and help you and you help them?
So, you know what, one of the things that would be really helpful and part of our conversation today, Kelly, is a couple things. One, the CARES Act has available $2 trillion for coronavirus testing. That's nationwide. Well, in July, at the end of July, the 1st of August, we had only spent $350 million on coronavirus testing. We still had about $1.7 trillion left. So even though we are constantly hearing that we're testing, we're really, the money that is being utilized is not, because not everyone can benefit from the CARES Act testing. MCI has the ability to benefit from that, from those dollars. So one of the things that would be huge for the African American community, we probably spent millions of dollars at the first run of this, getting out to the communities and trying to help the Black African American churches, because the best place for us to touch, the best place for us to get connected, to test, to save lives is through our community, is through the African American churches. It is always the backbone of what we need. And we really 100% need those pastors and those bishops and those mega churches to stand up. Because if you notice, our mega churches aren't testing us. They're not calling and asking to find a lab that will do that. So, you know, they're welcome to call me, to contact us, to see how we can support. Because if we don't start taking care of us, winter's going to be horrible for the African American community, and our losses will be significantly greater than any other community.
Colleen, that is my concern. I mean, to the point that I pray about it, I think about it, and I dread to think and shudder to think what could happen if we don't get involved in taking care of this starting now. So I appreciate you saying that and reaching out, saying, here, I'm here to help you, but everybody's got to get on board. You can't do it alone. I'm talking to Colleen J. Payne Neighbors. She is an extraordinary entrepreneur, but more importantly, she's an African-American woman who cares passionately about the future of our communities. And she's doing everything out there in Tulsa and Dallas, and actually, you've impacted the world with your testing. We'll be back and talk to you more about what African Americans need to do to get on board, not only with testing, but in terms of entrepreneurship and business development, because as you know, we've been decimated because of the disruption to our economy. Back with more after this. Welcome back to the program. So I'm talking to Colleen J. Payne Neighbors, and she's an incredible entrepreneur, but more importantly, she went into the science field. Right now, let's talk about the economy, because in addition to our health disparities, there's also the inequities that exist within the African American community, just by the sheer numbers of that CARES Act package getting out, some small businesses in the Black community not surviving because they didn't get the money. What is your best advice to Black-owned businesses or Black entrepreneurs or anyone trying to say, I can do better, I will do better, I will not let this stop me?
So, you know, with anything like this, in which this is something that I've never seen in my lifetime, which most people have never seen in their lifetime, and we hope never to see this ever again. But through this dismay to our economy, to our life, businesses are being made every single day. Our company has thrived. But at the same time, you know, we've lost 45,000 businesses over the time. So what do we do as an African American community? You know, sometimes we're always late to the game. You know, when urban renewal came in, we moved, you know, the other communities moved out of the downtown areas, and then we moved in. Then they came back and revitalized them. And by the time we got there, there was no more money. Yeah. So if we just move from the saving the lives and we move into business, and that's a hard transition for a medical person to make. But I want to make that on this show with you, Kelly, because this is still a business. We still have to have carriers. We still have to have suppliers. We still have to have test tubes. We still have to have plastic manufacturers making kits. We still have to have nursing people. Now we're getting into where we're doing home health. A lot of the medical parts of medicine has ceased. I mean, we almost came to like a 90% halt in the medical world. We weren't doing elective procedures. We weren't doing, the cancer rates have gone down. If you're following the news, how did cancer go down? Well, people aren't going to the doctor. Your doctor's afraid of you. You're afraid of your doctor. So now this is a season. We still have time for the African American community not to be as late to the table. So this is a season where great things are happening. So we still need an enormous amount of people to make all of these things happening. Healthcare professionals, drivers, carriers, people that's doing things in the medical surrounding COVID testing. What we need to do is think about that in terms of what can they not do? They can't get to the African American communities. They can't do testing sites in our communities. They can't do the drive-thrus in our testing communities. They can't provide some of the resources to get the $1.7 trillion that's still available. And it's very few laboratories that qualify to do that testing. MCI does on that part of it. So there's a lot of opportunity. And I think you have to think outside of the box at this moment and say, I'm sitting at my house, I'm not working. What's the need?
We're coming back with more after the break. It gives us a competitive advantage knowing that these companies need to get into the Black community, and we're already there. So why not start operating within the Black community and make the revenue that we need to, and then share it with the community?
Exactly. As we talked about a little bit earlier, there's no testing happening in the Black communities. So testing sites, we have to be very careful, but I can't reach every Black community. There's no way. But do we have the propensity to process 30 to 40, 50,000 samples a day? Yeah, we do. So how do we do that? Well, you know what? There's a lot of bandwidth to set up collection sites, but you have to be attached to a lab. So, we can pay you for the staffing. There's just a whole army, a host of things that we have the ability to do. I can't come out to every single community. Some of the labs don't need our business because they're so busy. Mm-hmm. It's not that I need or don't want our business. I want I want us to live. Yeah. So I prefer to have someone come to me and say, can we set up a testing? First, let's let us live as a population. Because see, you're not coming into the south side or the north side of our communities and testing us. We're not setting up a community because you're afraid of what? You're afraid of saving our lives? So no, we can do that. We can save our own lives at this moment. Let's set up our own testing sites. Let's create a momentum of our own laboratory, our own networks. I can process. The government still has probably over $1.5 trillion, but we're not getting it. Yeah. A lot of the labs aren't getting it because there's only a limited number of labs that can process based on the parameters that are set up. So we have a lot of things that we can do.
Colleen, I can tell you from my heart to yours that this show will be dedicated to helping you do just that, so we can save Black America from further heartbreak by making sure that we're getting the testing in those inner cities and in those rural areas where our folk live. And like you said, the larger corporations that are basically white owned are afraid to go into those communities. Let's make that happen. I will reach out to all of my contacts through this show and make it available to MCI. And I'm saying that on national television because it's just that necessary to do. And there are several corporations that I'm thinking of right now that would love to align themselves with an organization like yours that has the integrity and is recognized from the president to leaders throughout this country. So that's my dedication to you and to helping Black America, because like you, I care about our future and the future of our children.
Well, you know what, Kelly, I appreciate that. And I think it'll take, I am so appreciative of the energy that you have, that you want to help us. I just don't have, this is giving me a national voice, being on this show and on the platform and letting people know that we have the lab, we have the capacity, but I need you to help spread the word. And then collectively, I don't mind to set any time that I have weekly to talk about opportunities, because as an African American race, we're missing millions and millions of dollars of opportunity. And I think between the combination of you and I, we can rally the nation to support us during the rental months that's getting ready to happen. We need to have a plan. The Black churches need to have a plan. We need to be able to do two things. One, let's save our lives. But the second part is, while everyone else is making an enormous amount of money, we're not. We're waiting for people to come to our communities. We cannot allow this to happen. So the same level of commitment that you have, I have the same level of commitment, which means that if you invite me back every week, I will give a nugget of success to African Americans. I will set this up to where Black churches and Black businesses and companies can support us, but help save our lives.
Colleen, consider it done. We will be joining you weekly. I have a segment on this show called Strengthening the Black Family, or Strengthening the Family, and we need to make our families stronger by making our communities healthier. So I will see you next week as well on this show, where we talk about other opportunities that people in our communities can start going after. You remind me of Mary, Mary, go get your blessing. It's waiting there for us, and we've got to go get it.
Absolutely.
Thank you so much.
Oh, thank you, Kelly. I appreciate you, and it's always a pleasure.
I love your heart, love your spirit, and I love what you do. And we will definitely see you again next week. I'll work it out with you and your assistant so that we can make it happen weekly, because I think Black America needs to know. And that's the service that we provide on the Kelly Wright Show for the Black News Channel and for Black America. Thank you.
Thank you.
And we'll be back with more after this. And welcome back. I want to thank all of the guests who appeared on tonight's show, and I especially want to thank each and every one of you for taking time out of your schedule just to watch. I certainly appreciate you. Hopefully tonight we've been ignited, and united to keep spreading knowledge, faith, love, freedom, and peace. Together we'll get through this. Good night, everyone.
But comes with a price of forgiveness, and we all bleed the same. Yeah. If you don't feel it now, just wait. It's coming on, the love train. Just give it time, give it time. Get on board. That means you, and you and you. Get on board. All creeds and colors, brothers, all sisters and brothers, and sisters on the love train. Get on board the love train. Everyone's invited.